In May, we spoke with the specialists at Advanced Gastroenterology and Surgery Associates about hepatitis awareness. The word hepatitis means inflammation of the liver. This infographic is an easy way to find out if you are at risk. For instance, if you were born between 1945 and 1965, you are 5 times more likely to have hepatitis C. The specialists at Advanced Gastroenterology and Surgery Associates explain the differences between hepatitis A, B, and C and how they're treated.
Of the viruses, there are approximately 5 hepatitis viruses, A, B, C, D, and E.
Hepatitis A is an acute infection. It does not lead to a chronic infection. And it can be contracted orally, meaning eating contaminated, for example, seafood, raw seafood. People will get sick, but then the immune system will help them to get over. Hepatitis B and C are usually through contaminated body fluids. So, for example, exposure to contaminated blood products such as needle sticks, so healthcare workers. That's why healthcare workers are screened for B and C.
The one that's causing the most difficulty right now is hepatitis C, which when patients become infected, the majority, at least 85%, develop chronic liver disease, which can lead to cirrhosis and its complications thereof. Certainly anyone in the past who used intravenous drugs, especially sharing needles. I think we've also seen it with some people who use snort cocaine and sharing the tubes. That's a significant risk. Anyone who had a blood transfusion prior to the early 1990s would be at risk as well. And that's the difficult issue with hepatitis C. It rarely causes acute symptoms where patients may be sick or get jaundice like you do with hepatitis A and B. The symptoms can be very subtle, so it's very rare that we would see someone with acute hepatitis C. Most patients may complain of just feeling a little bit fatigued, which you can attribute to many other different things, or some discomfort in the right upper quadrant. However, the vast majority of patients are totally asymptomatic. It is not the death sentence as it used to be, and it can be managed. I think the difficulty comes in diagnosis. We need to try to diagnose the patients as quickly as possible, and in that way prevent the development of cirrhosis. Once they've developed cirrhosis, then treatment is not as successful.
It's estimated that 3.2 million Americans have chronic hepatitis C. For more information on the treatments and surgical procedures available at AGSA, please click the Hepatitis C Advances story link on our homepage, yourhometownhealth.com.